News Zoom room where the Speaker of the 36th Guam Legislature, Speaker Therese Terlaje, is standing by. Good morning, Madam Speaker.
Good morning.
Oh,
Good morning, KYM, Chris, and Jason, and Sabrina, and good morning, Guam.
Thanks for joining us, Madam Speaker. We're just going to get right into it, and I guess we'll start with this interview Nestor Lecanto did with the Director of the Bureau of Budget and Management Resources, Mr. Lester Carlson. And I'll just read you the lead to this interview. Lester Carlson paints a bright picture about next fiscal year's budget. He spoke at KUAM's Nestor Lecanto about why he is so optimistic despite the continued tourism slump and the end of most federal pandemic assistance programs. I guess so. Just your reaction on Lester Carlson's optimism, which seems to hold year to year.
Well, yes, I think we have. Well, they're projecting $72 million more in general fund revenues than this year, right? And a little bit less in special fund revenues, but that's similar to what they predicted for this year, that we receive more general fund revenue than what we actually appropriated. So I think the legislature is doing a very good job at holding down the spending of the government and, being pretty conservative about that. I had actually advocated that we adopt a higher revenue projection this year for the first time. And I wanted all of that additional $40 million actually to go towards income tax refunds. Because although, I have to give them credit, they have been paying refunds, there's still refunds that are outstanding. And I'd like to clear those off. I can't see why we can't just clear all of them off. Some of them, need additional work, but to clear those off, I want to, while we go forward, not, have any risk that refunds will not be paid. So if they're projecting 72 million, of course, we're going to go through the details of that and how they actually got that number. But it is true that this fiscal year, it looks like we are bringing in more than what was predicted. And so I think it's the legislature's challenge to try to, get close to the number that we are actually going to bring in and to put that into an appropriation or lock it up somehow so that it doesn't just get spent later as excess revenues in whatever manner, at somebody else's discretion. Yeah. And so spending discretion should be at the legislature. And so, yeah, I think we need to really exercise that as closely as possible, which is why I tried to tie up any money that might come in above what we projected last year or this year to go into refunds. And I'd like to do the same next year as well. I still want to ensure that our refunds are clearly paid. And if you look at their projection for refunds in the budget bill that they submitted for 2023 for the upcoming, budget process, it's still, I think, not enough. So we projected such a low amount for this year's refunds. And I really want to get an accounting on that when we get into budget. And what they are projecting for next year is it's only 90 million. We traditionally put aside 125 million and been told that that's not enough. So I think we need to really look closely at that. And that we haven't received yet word from the Department of Revenue and Taxation or the director as to what her negotiations are with the IRS regarding the earned income tax refunds. So all of that is still in play. And that will affect 2022, our current fiscal year, and next fiscal year as well.
Madam Speaker, can you explain, because I'm not so good with the whole budget financial thing. I mean, that's an issue that we pretty much leave to Nestor on the news team. But, when you look around and you listen to some of your colleagues talking about businesses are hurting and, there's people out of work. And when I drive around, I don't see, and again, I'm just a layman, I don't see an island that is, whatever, $70 million over what we're projecting. So I just don't know where's the money coming from, Madam Speaker. Can you help us understand?
I'm not an expert in that, but what they've told us is that this money is coming from, of course, federal aid. Federal aid is bringing in money, the equivalent of our budget amount, right? And if they spend that, and if they give it to corporations and they give it to individuals, and they are spending that there are some companies that are, getting that much in gross receipts, or getting that much able to pay employees. Not all companies. So you're absolutely right. It's still very, very clear that there are businesses that are shuttered, there are businesses that are not operating. Some of these businesses might still be receiving the federal aid, however, right, in the packages that have been distributed. There's been quite a lot of money that's been distributed to different businesses on Guam. I don't think all of them have really received it, but a lot of them have received a lot.
Madam Speaker, the administration submitted the most recent American Rescue Plan spend report, which I would try to look at it yesterday, but I feel the bottom line, one of the main takeaways, at least for me, was that there's still some over $400 million in ARP money that's has not been spent. But could we maybe just start with your reaction to the actual ARP spend plan reporting? Are you satisfied with the information that's being provided, or you feel like you guys really need more info?
Well, obviously, it's just broad categories. It doesn't give you the specifics of what they've actually spent it for. For example, this is a very good example, I think, and that's the public health. So they say they're giving public health, millions of dollars in ARP. But they don't tell you what that's for. Is that to make up for the budget shortfall, that they said they didn't want us to appropriate because they were going to get it from ARP? Where exactly is public health putting that? I've actually written letters to public health, messaged them, and different ways asked for exactly where's that ARP money. We've gotten no response. And so I don't think that's appropriate, especially if we can't get the responses from these agencies right away as to what did they spend it on. And obviously, we can FOIA all that, but I can't understand why we would have to go through all that process just to get this information. So I'm trying to think of another way that we're going to get this done without having to beg for the information that I think the public is absolutely entitled to, right? Where is this money going? We want to make sure, and I think it's fair that the public has a say in saying, well, that went to a good use or it didn't, right? And when public health comes back in and wants to tell us, they need more money or less money, of course we're going to ask them to account for this ARP money. So I just don't understand the delay in that. So it causes a delay, and I'm trying to compare it. This morning, I'm going to compare it to the reports that the governments and all states have to submit to the federal government, and I think those are kind of general as well. But for our purposes, again, I think this is information that the public is entitled to. So yes, the more detail, the better. And I think it would be beneficial to everybody involved to just show the detail as opposed to, going through the back and forth of it.
Yeah.
But otherwise, we know the broad categories, and we can see how they're changed, and we can see how they haven't allocated all the money yet.
Yeah, and so if you kind of look at this report, it's on the legislature's website. I'm going to send Jason over the link to put it in the comments, but it'll say stuff like, for example, Bureau of Women's Affairs, right? It'll say allocated 129,000 spent, 2,000. But what I'm seeing is a lot of these agencies that have gotten money haven't even spent it yet, right?
That's correct. And some of the agencies that we asked would receive some of this ARP money also have not, right? We had suggested that we need to address the water and sewer issues that are plaguing a lot of the lands on Guam where people are actually living, right? They still don't have this type of infrastructure, but the living has expanded, to these areas. And those include the Chamorro-Lantras areas and other areas. And I just had I listened in on their point in time count debrief yesterday for the Homeless Coalition. And they remind us again that there are these areas where people are living in Guam in poverty. They're living in substandard conditions. And a lot of that stems from the lack of water, the lack of sewer. And unacceptable,
Yeah.
right? And so they're looking to the government, and I totally agree that where we have people living and we expect them to live, and we want to grow businesses to support these communities, that we've got to bring in that infrastructure. So we have an opportunity to do that with the ARP funds. We have an opportunity to do that with the infrastructure fund. And so we are still urging that that be done. And so, you know, I had a meeting with the Lieutenant Governor. He mentioned that they were going to follow through with GWA's proposal to put some money into a couple of these areas, Atacao, I think, and maybe Zero Down. So those are two, right? And so we're just looking for some others with this funding that's still available.
And so that's, I know that in your submission to the governor's office about how you and your colleagues wanted to spend ARP, there was, I want to say it was 25 million that you had said wanted to set aside for infrastructure improvements and surveying lots and all that stuff for the Chamorro Land Trust in your meeting with
That's correct. 25 million. Yes,
right.
we had asked for that. Yes.
So in your meeting with Lieutenant Governor, how much was earmarked, and what did you find out about the other monies that you wanted for the other things that need to be done at CLTC?
Well, there is no money currently allocated for CLT properties, except there's that through that infrastructure, they might money going to GWA. I think GWA is leaning towards putting it towards, if I remember correctly, Zero Down and an area near Atacao. And so there are Chamorro Land Trust properties near that Atacao area, but there's also other properties. So that would be a good investment, I think. But that, yeah, I think that's separate. That's infrastructure funds. So
right.
we still have the big tracts of land, and I had Chamorro Land Trust prioritize these tracts, right? Which ones can we get residences in, and we can get more if we can get sewer, right? So when you put sewer in, you can cut the lots smaller, and because you don't have to account for a septic tank. So that's what I would like to do. Cut the lots smaller, put in more housing, or allow an opportunity for more housing, and get these people into homes, right? Instead of, we're still dealing with a lot of homelessness, a lot of shifts that have happened because of this pandemic. And I think that's one way to make up for it.
Speaker, I know that we're talking about infrastructure out to Chamorro Land Trust properties, but one of the conversations that we had this week with, I forget which mayor it was, but it was about abandoned vehicles. Abandoned vehicles on Chamorro Land Trust property. How do we kind of resolve this issue once and for all?
Part of it, I think, EPA is the enforcer of those things, and so that's one, arm of it. The other arm of it, of course, is just that the properties are not gated, or there's no fences, so it's just like any government of Guam property. It's not specific to Chamorro Land Trust. It's just that Chamorro Land Trust owns the properties that we can see, right? But it's the same with any private property that you can go and dump without being seen, or any other government property that you can go and dump without being caught, right? We see that on the road to Tagacheng. We see that everywhere. It's anywhere people can go and drive and conveniently dump without being caught is really the problem. It's an island-wide problem. I don't think it's specific to Chamorro Land Trust. It's just noticeable there because they have these huge tracts of land, and there are not people living on them right now. But I think Chamorro Land Trust has also, taken measures. They went through and cleared up, remember, Swamp Road and some other areas not too long ago, maybe 2 years ago. And I think that they had agreed at that time to, watch. I mean, they're going to have to just report it more often to EPA. EPA tries to cite these people, but otherwise, the solution that they had proposed was to fence these properties. And that's an investment of money, I think, that I would like not to spend if we don't have to, because putting up fences takes away money from putting in roads, bringing in the sewer and the water, or doing the surveying of these properties and actually giving them to someone so someone can be living in that property instead. And so that's the trade-off. But, of course, the other side of the coin was that the, administration is supposed to be working on another way to prevent dumping, and that was to to require an island-wide trash pickup service,
yeah.
right? So if that gets put in promptly, we'll see how that resolves the issue.
Yeah, but instead, what we have is they build these roads out to these properties that maybe haven't been divvied up yet, and you end up with these roads to nowhere, like you said, where people can just drive off and dump stuff. I just had another land question. I know Bree's got some questions for you, but this is relative to Eagles Field. I believe the governor had popped up in another media saying that, oh no, the admiral's not correct. That she was hearing that they were going to build the missile defense system, possibly like next to the hospital, but we haven't been able to confirm that with her office. Or, well, I mean, we had the admiral on the show, and he said what he said. But have you heard anything else about this situation up there at Eagles Field?
I heard that interview with the governor where she said that she had met with MDA, which I'm assuming is the Missile Defense Authority or something, and that after that meeting, she was assured that this property would be taken off the list of excess lands, and that's very disturbing to me. I have to say, I feel so bad for the landowners that first they were bypassed in the process of how their excess lands, when returned, would be used, or whether they would be returned to the landowners or not. And now we have a whole other issue of, it seems like the governor has agreed that these lands would be removed from the excess lands list. That, that does not sit well with me. I feel like, if we let that go, we are really going backwards on what we have tried to do for years, and that is to point out the land that's not being used, the land that looks excess because it has not been used, and that should be returned to the government. And it also, goes back to the military's promise. This is the Department of Defense making a promise in 2010 that they would use less land in this buildup than prior, right? And that's why Congress, because DOD was not moving on the return of excess land, Congress put it into that NDAA law that a certain process of what the Department of Defense had to follow. And that is the governor requests and they respond to every single parcel as to whether it can be returned or not. And so they had already agreed that this is excess and it would be returned. So this whole change in position by both the admiral and the governor are really concerning for me, that the land was found excess and now all of a sudden it's not. And all of a sudden now only the parts that are available for the hospital are going to be released under a lease, not even outright returned. And what is the sense of that, right? If they're going to allow it to be used for a hospital for 50 years, is it access to them or not? It seems excess, right? I mean, this just goes back to, I think the struggle that the landowners have been facing for 50 years or longer, right? Since the takings, and it's just not just. So I'm going to continue to work with these landowners. I think they should have a say in that, and I think that they should not give up. I think this is something that that we should be very united about, and I'm looking to the community to be united about this. It's they have 1/3 of the island available to them for use. And I just think this property can, and they've said they want to build a base all over Guam. That's another thing that, concerns me. But so I'm going to continue to discuss with the landowners, urging the governor to urge the Department of Defense to return the land as excess, to stick to their original promise.
We did have a couple comments. Thank you, Speaker, for this opportunity to improve infrastructure for our people who are suffering the most. Let's do it. All us public servants must do what we can. So many in need. F. Glenn comments. Busta, let's get real. Eagles Field is not going to be the new hospital site. Bree, I know you had some questions. Good morning.
Yeah, Speaker. So Eagles Field actually was just one of other alternatives.
Sabrina, sorry, I can hardly hear you.
Oh.
Eagles Field, it was just one of other alternative sites. Do you recall what the other sites were?
They said generally there was one near Atticao. I don't know specifically where, but they keep saying Atticao. That's the second one. And the third one, of course, was the Oka Point. And then the current hospital site. Those are the only four that I'm aware of. If there are more, there may be more, but those are the four that I've heard them discussing in different meetings.
I see. Okay. I also wanted to follow up on the licensure for these new paramedics, these firefighters and other people that went through all of this training over at the Guam Fire Department. Do you have any update on that?
I don't have a recent update, but I know that I know I discussed this with the HPLO, I believe, and which is the Health Professional Licensing Office. And this is an issue that is on the EMS Commission's agenda, right? And it's also something, I'm sorry, I'm trying to remember, but if I remember correctly, it's even the Lieutenant Governor had said that this is something that they are trying to resolve. And I know I've heard, just like you probably, that there are people who went through that and then they went off island to get their actual certification because they were frustrated that they couldn't get it here. But it was my understanding that they were going to resolve that. But no, I don't think it's been resolved to date.
Okay. And
I think this is something also that, we had discussed with GCC as well.
Mm-hmm. We haven't really heard a whole lot out of the Guam Memorial Hospital. Have you heard anything? Like, what's going on over there?
Well, what I've been concentrating on and what I've heard talked about recently is pretty much the medicine that is available to treat this Omicron strain, right? And so the medicine that was available was distributed to GMH, GRMC, I think SDA, Guam Radiology. And so those clinics and hospitals were supposed to give these treatments, these IV treatments to patients that were at highest risk and who had tested positive. Public Health was also supposed to distribute these IVs themselves at the northern and the southern clinics. But my understanding is that they were not able to stand up either of those. So what Public Health did was set up a tent, or they used the blue tent that was outside of GMH. And that's a public health distribution center for the IVs, antibodies against the Omicron. So those are the IVs. They were a very limited basis, right? But then there were also pills that were distributed, of course, to the hospitals for patients, and they've been distributed to the pharmacies. And my understanding is that they haven't had many takers on those pills because the pills have a high, to be eligible for those pills, you can't be on any, pretty much any other medicine. You can't be at, it's the way they interact with other medicines, which a lot of our populations are on for heart disease or, diabetes and that type of thing. So they are not eligible. So unfortunately, we have a high risk population not able to use the pills, and they kind of need the IV, which is in very short supply. But so that's what we are following up with, and it looks like they're continuing, Public Health continuing to make orders for these antibody treatments, but it's a matter of waiting for the orders to come in and just continuing to place orders. But they seem on very short supply, which is very troublesome, of course. But and I think I've heard of some people who were rejected for the treatment, right, and said they're not eligible, they're not high risk enough, or something like that.
Yeah, and even just the concerns about the test kits. I mean, we were 8,000, and then thankfully we got a shipment yesterday. So.
Right. So we knew for a couple weeks ago that they were running low, that there were no orders that had been made. And so I think Public Health scrambled to make these orders, and they've now got a system, I hope. The way they described it to me, it seems like they've got a system that They are going to order from different suppliers, and so we should be able to receive regular shipments, and we will not have that threat of running low again. It doesn't make any sense if we're going to have that threat again. So hopefully when we get additional test kits in, they are going to, expand this testing. You saw the results yesterday. It's like 50% of those that came in to get tested or maybe 44% came in and they were tested positive. So of course we've limited the testing, but those who are being tested, it's still a high number, right? In the 400s, I think, in a day. Yeah.
Mm-hmm. Have you
So
heard?
it's still a high number of positive cases. I think that's still concerning for our hospitals.
Have you heard anything about the quarantine and isolation facilities? Because, when you look at that expenditure and allocation report for the ARP money, 21 million going to pay for quarantine and isolation facilities. I know we're trying to find out how much has actually been reimbursed, but there was that effort to consolidate the two facilities into, one.
Right.
Have
Which
you-
I think they have.
They have?
I think so. Yes.
So Bayview's now the quarantine and isolation facility?
Yes.
Oh, when did they do that?
Oh,
Yeah.
I
heard
believe
that.
when you were gone.
yeah. I'm pretty sure that that's done. And I don't, the thing is they don't do much isolation. I think
They don't actually, Speaker. They don't do much quarantine. Yeah,
Yeah.
Yeah.
What's that?
they don't do much quarantine. It's
That's what I mean.
isolation.
Yeah, they don't do much quarantine. It's primarily isolation now. These are for positive cases. Yeah. So yeah, it's not clear yet. And Sabrina, we've been asking since day one, right? How much of those quarantine facilities where we are using now ARP money are going to be reimbursed? We can't get a clear answer. And, I don't know why. I think they're still waiting to see whether they can get reimbursed. Maybe they don't know the answer, but we haven't received the answer. We've made that inquiry since we first saw that on the ARP expenditure reports that they're using that. Of course, we're looking for reimbursement for FEMA, or that's what my guess was, that quarantine and isolation would be covered by FEMA. And so if they're not, I'd like to know. And if they are, of course, I'd like to know, because that's $30 million now that we can allocate elsewhere. That would cover the infrastructure we're talking about.
Madam Speaker, have you heard any update at all about the financial management system?
The emergency procurement?
Yeah.
No, sorry, I haven't been tracking that. I'm assuming, it's been on every, I've seen it on different reports. Remember, I think that was under a CARES report. And
Yeah.
I don't remember, I'm sorry, but I don't think it was, if it was not completed when we went through the budget cycle. I know that was in July. So as of now, I'm not sure. I think they, said they issued an RFP. I don't know.
I think
I
they
don't
might
know.
have. Well, I'll find out. So you don't have any info on it,
No, I'm sorry, I don't. I can follow up with Senator Paris, though.
Right,
She's the
yeah.
oversight of Department of Ed. So we're having a session coming up on February 18th. That's the end of the month. So our sessions are normally at the end of the month, right? We pick the last week of each month, and I kind of reserved that in advance with the senators. It's informal because I haven't made the call yet, but that's kind of the informal reservation, the last week of every month that we're going to have session. I try to give this to them in advance so that they can plan their traveling and everything else around those dates and feel a little confident that, they can schedule whatever they need, medical care and things around those dates. So our next, we should be having session on February 18th. Today, we're going to be having a Committee on Rules meeting. And in this meeting, the Committee on Rules meeting is where we set the agenda for the session. And so all the bills that have been reported out of committee, those are available to be put on the session floor normally. And so at the Committee on Rules, we kind of narrowed that down to our wish list of bills that we are going to deal with during session. Of course, everything's ultimately up to the body and on the session floor voting to act on a bill or not. So, But so the Committee on Rules has issued their agenda for today's meeting, and in that agenda, they list all the bills that have cleared the committee, or they've been reported out of individual committees. They've cleared the Committee on Rules. They should be posted up on the legislature's website for all the public to see. And so after today, we'll know which bills they intend to move during the session. There are a lot of bills. I'm looking at the list. Some of these have been reported out for a while. Some of these have been newly reported out, and these are the earned income tax, the bills that want to use the earned income tax reimbursement monies. And these bills, for me, I'm looking for the Director of Revenue and Taxation to confirm with us what her arrangement with IRS is. Are we going to be paid in advance for these earned income tax, money that must be credits that has to be paid out to the taxpayers, or are we going to be paid after the fact as reimbursements? And because I think that makes a big difference as to whether these monies are really available to us or they're not. If you remember the child tax credit, that was all put into a trust fund in advance, and the director could only use that money to pay out the child tax credits. And so if that's the same setup with the earned income, then this money might not be available for appropriation. So there's still, we're still going, lately, I don't know if you've been watching, we've been having public hearings, and we're having a hard time getting, I think, the information that we absolutely need in order to make good policy. So we have hearings, we invite agencies to come in, but unfortunately they're not always showing up. And for example, in these cases, we just don't have the answers. Revenue and Taxation says for the earned income tax credit, they don't know yet. They will know shortly, she says, but she doesn't know yet. And so I don't know. For me, I'm just getting concerned that there are bills, they're quite complex. They are going to have significant impacts on the people of Guam. I would like the agencies who are also going to be significantly impacted or charged with enforcing some of these bills or laws that we are proposing to really be, attend and to tell us clearly, with as many facts as possible, what the impacts are and whether they are going to be able to enforce this. One of the examples was the hearing on the bill for the abandoned vehicles. The mayors were in there saying their side, which is, very clear. This is urgent. These are our impediments. But we had no one from the other agencies to come in and say why they weren't able to address, those concerns of the mayors promptly, or what is the status of getting an impound lot, or what is, DPW's limitations, GPD's limitations, the AG's interpretation, that type of thing.
So what's the difference, Madam Speaker? Because I remember just watching session, as recently as, 4+ years ago, and you would routinely see any bill that had something to do with agriculture, the agriculture people would come, or if it was a bill about crime, you would have the police department or the AG's office come and they'd give the statistics. So what's the difference between then and now? And it's not just what you're saying now. Earlier in this interview, you talk about you write public health, they don't even respond. So I don't understand we're looking at a Democratic majority in the legislature who can't seem to get the time of day from the Democratic governor in Adelut.
Well, I would say that it's inconsistent, right? So yes, sometimes they're very responsive. The agencies will be all in full force, sometimes not. And sometimes, we have to beg for the information as opposed to, we get it immediately, which I'm telling you, in the beginning of the term, I was so grateful. I thought that almost all the directors were very responsive and were very willing to give information straight up, facts, no rhetoric. And I can operate like that. But the inconsistency is really what's bothering me. And I'm considering going forward at least for my committee's hearings, issuing subpoenas, if I need to do that. It seems like an extreme measure for just the government agencies, right? And I feel like if directors can't make it, it's so easy for them to send staff. Yeah. It's these classified staff who have been working on these issues for years, in fact, right? And I'm sure they can answer the questions, but I don't know. Maybe I'm thinking out loud. It's getting not just frustrating, because frustrating is one thing, but really it's getting to me that we cannot be confident about the policy we're passing without that broad input. And that's the whole reason for open government. And I think we've done an excellent job of opening the government. You know, it can always be more, but we've done a very good job. We've required every bill to have a hearing. But when these agencies don't show up or don't want to give input, then, you know, it kind of defeats that purpose. So the public, of course, we want them to participate in their government, but I think that they should know from all across the government, you know, and use the best resources. These agencies are getting resources, right? And they should in turn share their knowledge, their expertise with the public, so that, you know, everybody on Guam can be on the same page. And I feel like that's where a lot of the discord arises, is when we're operating from different facts or different, you know, interpretations or different beliefs as to whether something's workable or not. And that's based on, you know, who knows what sometimes. And I don't like to operate like that. I want everything out in front of us. I want, when senators vote, I want them to be voting informed, not ill-informed, not in the dark. I think that's very bad policymaking. And so I just think we have to do something different if we can't get the responses. And you've seen, you know, sometimes we have a go around in the budget as to, you know, some of the language, semantics. Sometimes we pass laws and they say they're not going to follow them and we don't know why, right? Or they say they don't have to follow them because we didn't use the right word. Things like that, very frustrating. And I feel like that's I don't know. So I feel like all around we could always do better with this open government, but I feel like we need to also, you know, hold these agencies accountable as to, you know, we need to all work together to get better policy, to find out what the impediments are. You know, when I listened to this homeless coalition yesterday, we know poverty is a growing issue on Guam. It's been a big issue, but it's a growing one, which, you know, because of all the conditions, it's growing. And the people, what's really alarming is people who have been doing, you know, work with the homeless, doing the actual services, they are really shocked. And that should be a concern to all of us, right? That they are troubled, they're furious, I think, inside, but they are just some of the nicest people on Guam. So they don't say it like that, but I think they are frustrated with the response of the government, and that we have government working hard, yet we have to respond quicker. You know, when there are children out there living in substandard conditions, when there are elderly. And one of the questions somebody raised yesterday during that debriefing was, we should have known, we as a community, we as a government, we should have known that people were living like this. So they go out there, they see it, they report it, they make a referral to all the agencies involved, but they're kind of, upset, and rightly so, that we should have known earlier than this. Like, we can't wait for the one time per year counts to realize this information. So we have to. That's, I don't know, for me here as a senator, that's what I find too. I spend a lot of my time following up with agencies to see whether they are really implementing what the law says, to find out what's their impediment, why are they not implementing what the law says, what is the delay, things like that. It takes a lot of patience, to just keep at it. And I feel like I don't know, of course the pandemic has just exacerbated all of this because they've grown in duty. So, I got to give public health credit. Their duties have, tremendously grown because of the pandemic. So some of their regular work, may be delayed, but it can't be, unfortunately, because it's public health, right? It's like we can't afford any part of public health to be delayed. We need a whole system to get these services that are available out there. And we've had oversight hearings before, and this kind of is the conclusion that everybody has decided, yes, we need to get the clinics out into the communities where they are needed the most. People can't even come in for testing. They can't come in for vaccinations. They don't have transportation. This is the types of communities we're talking about. We need to get these clinics out to them to prevent the dead on arrivals, right? Yeah. We knew this a year ago because that was the proposal made during the last variant, right? Or the original. And so it's just that. It's like we can see with this Omicron that we are doing these things again, you know, running short on test kits, you know, ramping up our ordering skills and our ordering procedures so that they don't get held up in any other agency, things like that.
Ordering skills. Wow, Madam Speaker, thank you. We got to do the news, but yeah, it definitely sounds like there's a lot of stuff. No, but I just got to say that, I mean, you guys have allowed this to happen. These directors not showing up, and it's now Chris, at the point where
I take exception to that we have allowed this to happen. You know, we have a very clear role here in the legislative branch. We do policy and we do oversight. And I think I have done oversight after oversight without trying to bring public health in here every single day and impede their ability to do their job. We have to balance that as well. And so I'm just saying, no, everyone has to do their job. You know what I mean? Every single person in this government has to carry the weight because there are communities out here, and these are our communities who are suffering. And so, no, I don't think anybody has allowed it to happen.
No, Madam Speaker, I'm just talking about when these directors no-show at these hearings. It's happened so many times.
And that's why I'm saying I'm looking for another method now. Yeah. If our invitations are not enough, then we will definitely.
Clearly, I think the time for subpoenas passed, a while ago, because they just don't have any respect. I think it's about the respect of the job that they have. Respect for the job it's huge.
I agree. It's a respect for your job. It's a respect for the people of Guam, that do they deserve to hear from you or not? And I find it very frustrating that we can't get directors to answer directly for things, and that, I think we need to happen a lot more often. And I want to thank the directors that do respond quickly or, respond with. Some of them are so thorough, right? And so I'm very grateful for that. But I just think it has to be consistent. And so I just hope we can all do that.
Well, let us know when you send your first subpoena, because I think that's definitely newsworthy.
Thank you.
Thank you, Madam Speaker.
All right. Everyone have a good day. Sorry if I was going off.
No, hey, go off. Go off, Speaker. People are going off out here. They're just as frustrated, if not more frustrated than
Well, I'm just saying, to end on a positive note, I try to take that frustration and, put it into something beneficial. Like if it needs a policy change, then we're going to make that policy change. If it just needs, the directors to be encouraged or something, I'm going to try to do that. But we really just need, so much of this is already outlined in law. It's outlined, everybody knows the goal, I would hope. And that we just have to really work together to get there. We have to remove all these impediments, or my agency doesn't handle that. Only theirs does, that type of thing. Yeah. It has to be coordinated.
Thank you, Madam Speaker.
Thank you so much. And Sabrina, I'm glad to see you back. We really missed you. And again, condolences.
Thanks.
Thank you.
Speaker.
Madam Speaker, Therese Terlaje there. Go register to vote, guys. Yep, gec.guam.gov. Make sure you're mad when you do it. Go register to vote. You can do it totally online. You don't have to look at anybody in the face. Do it. If you want to look at people in the face, you can go to the GEC offices in Okatamuning. It's 821, Wednesday, February 9th, 2022. Let's go ahead and get into the news. Who's doing the news? Jason Solis is doing the news. Hold on, let me check my computer because